Keteyian, welcome back to the show.
Thank you.
Last time you were here, Andy sat in for me because guess what? I had COVID.
COVID.
Yeah.
It gets everybody eventually.
And you've had it.
Mm-hmm. Yep.
The 3.5 years I worked really hard to avoid it, but it got to the point where, you know, I didn't remember anyone like breathing in my face.
Coughing right in your face.
Yeah. It's
hard to avoid.
So fall has been, over the last 3 years, a point in time that we've started to see increase in cases. What's the outlook for this autumn?
I mean, predicting the future as much as I can. I mean, I think we saw every fall we see a tick up in all respiratory viruses, flu, RSV, COVID. We saw that again really coming out of Labor Day as school started into September. The epidemiologists now don't really look at as much at the testing and the cases because testing's so inconsistent. We look at hospitalizations because that gives you an idea of severity, but the wastewater data is actually really useful because you can see just burden of genetic material in the wastewater in communities. And so in Jackson, that peaked about a week ago, actually, and we've seen it trickle down a little bit, which has been very good. But still higher activity now than we had like in the summer, right? So it's not unexpected. We'll see things still tick up again. There's always people in the hospital now with COVID. It's pretty consistent. And I think we'll see not only COVID, but we'll see flu and RSV too still here more before. I mean, we're just getting into that kind of season now.
And you anticipate RSV hospitalizations?
Absolutely. Yeah, absolutely. Yeah, every year we get people hospitalized with RSV. It's usually the young or the old, right? Very young or very old. There's actually vaccines for RSV now available. So the 60-year-old and over cohort can get an RSV vaccine, which I would highly recommend. And for younger kids, 8 months and under, every kid 8 months and under, there's actually a monoclonal antibody vaccine that is available for that group. And then for higher risk ones, 8 months to, I'm not a pediatrician, but I think it's 8 to 16 months, they can also get it as well if they're kind of higher risk. But that's a really, obviously people with kids in those age groups should have pediatricians and rely on their pediatricians for advice on those specific vaccines. But those are very good therapies that prevent really severe disease in that age group of kids.
Yeah, it's so scary. A little infant gets sick.
Yeah, 3 or 4 months old getting sick like that is not a good thing.
Yeah. All right, so the new vaccine is it's out. It's available.
It's available.
And it's distinctly different from the boosters of the vaccines of years past.
Yep.
What's different?
What's different? Yeah. So the so kind of like we do every year with flu now, where they will match the vaccine to the circulating strains. The same thing was done with this vaccine compared to the circulating strain. So everything now is in this this like Omicron family. We had all these different variants, right? There was Alpha, and then there was Delta, and now there's Omicron. And so the Omicron variant has been the most contagious, and the vaccine is based on that Omicron variant. And so the matching of the vaccine to the circulating virus is very, very good. And so that's the big difference. And the other ones were called bivalent in the past, meaning they were including more than one type to kind of cover the different circulating strains. They only included one strain because Omicron has been the dominating circulating one. So that's the main difference. The other main difference is there's no more of this like get it again, right? It's you get your shot and that's your 1 year. So for anybody who's 6 months and over that's had a previous vaccine at all, they're just getting one. And that's the majority of Americans. Something like 80 or 85% of Americans have gotten at least one vaccine.
Yeah, I think that was one of the big problems. People got part one and they
They didn't follow up, yeah.
So if you've had COVID, should you get the vaccine?
I would, yeah, I would. And I can tell you many anecdotal stories of people that I know that had COVID 6 months ago and then got it again. And those aren't folks that have like, severe, crazy immune diseases. They just got it, and the immunity tends to wane over 3 to 6 months, and then they're susceptible again and they get it again. So yeah, I absolutely would.
So let's talk about timing. Let's say you got COVID a month ago. Let's say you got the old vaccine 2 months ago. At what point should you get the vaccine?
So if you've had COVID, the typical kind of consensus is you wait about 90 days is probably their sweet spot to get the vaccine after having it. Most people now, because they've stopped giving the old vaccines quite a few months ago actually, so there wouldn't be anybody that would have to really wait at this point to get it because they had the old vaccine. But if you've had COVID, you do have some immunity from that, and so it's worth waiting 2 to 3 months and then getting the new one.
So the first round of vaccines, they were free. Is there a cost to the new vaccine?
The government no longer is just paying for these and handing them out. So now this is like everything else. It's insurance covers it, of course, but it bills through insurance, or people pay cash for it, I guess, if they're not insured. But they're not free like they were before. There are certain categories like vaccines for children. There's programs that make these things accessible to people that are in lower income categories. But they're not just sort of like free for the masses like they were originally with the other vaccines.
Now they'll be more popular.
Maybe, actually. Yeah, that might be true.
So we've got RSV vaccine, flu vaccine, COVID vaccine. Can you get all three at the same time?
You can actually. You can, yeah. And so I would actually highly encourage people. It's convenient. Just get the flu and the COVID vaccine at the same time, one in each arm, and just do it and get it done. And you'll probably feel, you might feel a little, lethargic or achy for a day after that, which is actually a good thing. People will say, I got the flu from the flu vaccine. You got a cytokine cascading reaction, which is good. Like your body is reacting to the sort of the fake infection, which you want. That gives you a good immune response, and it lasts for a day. But I'd rather kind of get it out of the way and just do both at the same time and just be done with it, which is what I did.
So that you mentioned one of the side effects from the first COVID vaccines, people felt tired the next day, and there were people got the recommendation, well, take the next day off, just lay low. Do we have the similar side effects with this new COVID?
It can be, yeah. And, I mean, any vaccine, really. Any vaccine can cause that sort of reaction for 24 hours after you've had it, because it's stimulating your immune system, and that feeling we get is it's not the virus specifically causing that. It's our immune system fighting the virus. So if it's doing its job, then yeah, that'll happen.
I want to ask you about news from last week. Henry Ford Health announcing a deal with Ascension, a big national health care organization with locations in Michigan, that you're partnering or merging or taking over the Southeast Michigan Ascension, and they'll be branded Henry Ford. What does that mean? I mean, that creates a huge system. What does that mean for those of us that either are patients or work for Henry Ford in Jackson?
Yeah, no, that's a great question, and it was that was kept very quiet for a long time, and even those of us who are fairly senior here locally didn't know about it until maybe just a little bit before the announcement was made. So that's had been worked on very quietly for quite a while, and the way that it's designed is as a joint venture. So the Michigan essentially chapter of the Ascension system, and the majority of those components are merging together into this joint venture with Henry Ford. So Henry Ford and our hospitals, Health Alliance plan, the insurance company, all of that's part of the joint venture on the Henry Ford side, and then all of the Ascension hospitals are in Southeast Michigan, and actually try to jump to Flint. So Genesis is part of the Ascension system as well in Flint, or Grand Blanc. Those will join together and become this new combined like joint venture entity. Ascension is actually based in St. Louis, but it's a national Catholic hospital system. I think it's hard to say, what is the impact on all of the communities. I think we've seen more consolidation happening in the hospital industry. I mean, there are multiple, I could name, 10 hospital systems that are now across the entire United States. The big one in Michigan was when Spectrum and Beaumont came together and created Corewell. So the idea is that it creates some efficiency and savings, right, on your those types of things on the back end, right, purchasing supplies and equipment and inefficiencies with staffing and in IT and all those types of things. So hopefully that makes us a more efficient and more effective organization to deliver care, no matter where that is, right, whether it's here in Jackson or in other parts of Michigan.
And they'll be rebranded as Henry Ford.
It's going to be Henry Ford Health, yep. So the headquarters will remain in Detroit. Bob Riney will be the CEO. He's the CEO of Henry Ford Health now. Bob will be the CEO of the joint venture. And the locations will be Henry Ford Health locations in the Henry Ford Health name, and be headquartered in Detroit. So that's the plan.
Yeah, and I think Henry Ford is it's a great brand in healthcare. And I was really surprised when Spectrum and Beaumont ditched what I thought were two pretty well-regarded names in healthcare to create a new name, Corewell, which I think is the stupidest name they could have come up with.
Yeah, I wonder sometimes about that, the brand equity type thing. If you've got really well recognized, established names, and then to start over. We went through a very long exercise to just go from Henry Ford Health System to Henry Ford Health. So, I think there's, but there was obviously a lot of research done to determine, what resonates well with people. I think. Yeah, so we're not going to change the name, so I think that's one thing sort of off our plate. We don't have to figure out with the merger, which probably is, that's an excellent outcome, actually. We don't have to be distracted with that.
Yeah, and when you did change the name, you changed the logo, and I didn't really think about it at the time, but last week, Eddie Bauer changed their logo because it's written in cursive, because they said, well, kids can't read it, and when you changed from Henry Ford, you had Henry Ford's signature in cursive to your new block letters.
I can tell you, in the meetings I was in, that was never one of the reasons that was brought up, was that we were worried people couldn't read the name. So we didn't. Yeah, that was definitely not part of the conversation.
All right. Well, thanks for all the news, and thanks for coming in today.
Absolutely.
Vice President of Population Health at Henry Ford Jackson Hospital, Dr. Courtland Keteyian.